Dr. Kendall, my name is Heidi. I'm a nursing student at WKCTC. I'm here to do your head to toe physical assessment. This should only take a few minutes and it shouldn't hurt, okay?
Okay.
I have closed your door to provide for privacy. I've washed my hands and putting on my gloves. I have raised the bed to promote good body mechanics. Can you tell me what your name is?
Brady Kendall,
And your date of birth?
7572,
And where are we at today?
Paducah, Kentucky.
And why are we here?
Head to toe assessment.
Patient is alert oriented ×4. Can I see your wrist? I know I've already asked you this, but what's your name and date of birth?
Brady Kendall, 7572.
Can you squeeze my fingers for me? Grips are even and equal bilaterally. Okay, look straight ahead for me. Pupils are even, equal, round, reactant to light, and accommodation 2+. I'm moving on to my respiratory assessment. The chest is symmetrical. Color is consistent with the rest of the body. There is no masses or bulges seen. I'm going to check my respiratory rate. Respiratory rate is 18. Breathing is unlabored. Okay, I am going to move on to palpation. I'm going to palpate the chest for masses, bulges, movement, anything abnormal. There's no tenderness noted, no masses, no bulges. My patient is not grimacing or wincing. I feel no masses or bulges. I am going to check for capillary refill. The capillaries refill within 3 seconds. I am now going to auscultate using my diaphragm. Breath in and out. I'm listening to 5 anterior sites, and 8 posterior sites. Breathing is unlabored. It is equal on both sides. There is no crackles or rhonchi heard. Breathing is clear. Respirations are clear. I am going to move on to my cardiac assessment. I am inspecting the precordial areas for pulsations. I am checking the carotid arteries for jugular vein distension. There is no jugular vein distension noted. I note no pulsations in the carotid arteries, or no pulsations in the precordial areas. The aorta, which is 2 intercostal spaces to the right of the sternum. The pulmonic, which is 2 intercostal spaces to the left of the sternum. The Erb's point, which is 3 intercostal spaces to the left of the sternum. Tricuspid, which is 4 intercostal spaces to the left of the sternum. And the mitral, which is 5 intercostal spaces mid-clavicular line. The mitral is also the apical pulse. I note no pulsations in the precordial areas. I will now auscultate the precordial areas. I will use my diaphragm. Aorta, pulmonic, Erb's point, tricuspid, and mitral. I will now listen to my apical pulse using my diaphragm for 30 seconds. Apical pulse is 70. I'm now going to listen to my carotid arteries using my bell. There are no bruits noted in the carotid arteries. All precordial sounds are even. I hear no irregularities. If I heard any irregularities, I would listen again using the bell side of my stethoscope. I now move on to my peripheral vascular area. I am looking for edema. There is no edema noted. The skin color is consistent with the rest of the body. I am going to check my points of maximum impulse, which are my carotid arteries. You check these once at a time. The brachial arteries, the radial arteries, the femoral arteries, popliteal arteries, dorsalis pedis, and the posterior tibial. All of the pulses in the arteries, points of maximum impulse, are even bilaterally. I am now going to palpate the peripheral vascular system for edema. There is no edema noted. There is no pitting noted. I move on to my abdomen. Abdomen is flat, symmetrical. Color is consistent with the rest of the body. I see no masses, no bulges. I'm going to auscultate using my diaphragm. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are present in all 4 quadrants. I'm now going to listen to the arteries, aorta, renal, iliac, femoral. I listen to the arteries with my bell. For bruits, there are no bruits noted. I'm now going to palpate the abdomen, left lower quadrant, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. There is no masses, no bulges, no tenderness. There's no rebound tenderness noted. I am going to lower the bed, put the bed rails up or down depending on the patient's care plan, place the call light within reach. I am going to wash my hands, document my findings, and if I have any abnormal findings, I will report to my charge nurse.